Dear ASES members, American Shoulder and Elbow Surgeons aspires to provide its members benefits above and beyond traditional educational programs. Today, I would like to highlight our advocacy efforts. Political advocacy means using our expertise, position, and voices to ensure that healthcare policy is informed by clinical reality and patient-centered values. Over the last decades, our profession has faced mounting pressures, regulatory burdens, declining reimbursement, rising costs, and a growing intrusion into the doctor-patient relationship. While this may seem distant when you're in the operating room, decisions made at the state legislatures and Capitol Hill impact patient care, and also whether we are compensated fairly for the work we do and how we shape the future of shoulder and elbow surgery. At ASES, we are lucky to have many members who volunteer time and energy to advocate on our behalf. Please listen to Dr. Brad Bushnell, Chair of our ASES Political Advocacy Committee.
Hi, I'm Brad Bushnell from Rome, Georgia. I'm the current chair of the ASES Political Advocacy Committee. My friend Joaquin asked me to say a few things about what the Advocacy Committee has done this year, in the past, and what we have coming forward. I'll divide it into three main areas. The first is our partnership with the AAOS PAC. We work with them a lot on interacting with legislators, politicians, regulators, and the like to make sure that our policies that are coming down are in our best interest. Things like prior authorization reform, Medicare reimbursement cuts, really advocating at the federal level for all the surgeons in the U.S. The second area in which we're involved is education. This is highlighted by our participation in the last several ASES annual meetings, including this past year where we had our guest, Adam Bruggeman, who is the chair of the AAOS Ortho PAC Advocacy Council. It was great having him at the meeting to share with us what all is going on at the federal level. In past years, we've also had guest speakers from the realm of politics, from the realm of regulation, as well as our own members highlighting their research. Second area of education that we are proud to be a part of is the 7-year history of the Mark Frankle Advocacy Fellows program, in which we take members and spend a whole year learning about advocacy, working on advocacy research, going to DC to participate in leadership councils, the National Orthopedic Leadership Conference, and other events. The final area that I'm personally very proud of is our advocacy research. In the past few years, we've put out a lot of papers in JSES that have been essentially thought up by, designed, executed, and published by our committee members. Claude Jarrett has been a big part of this. Hafiz Kassam has been a big part of this. And the whole committee has really rallied to these efforts. This really came to a capstone just this past winter when we rolled out a 31-article issue. It was a special issue of JSES highlighting advocacy and health policy research. I hope you'll all read it. It's available online. Just really a lot of exciting things in there. We had international perspectives from 8 different countries. We had expert commentary, and we had original research in that. So those are just a few of the things that the Advocacy Committee has been up to over the last few years. I hope all of you will continue to support these efforts, and we'll see you at the annual meeting. Take care.
So what can you do? At a minimum, stay updated on legislative issues affecting us. But there are other opportunities: donating to the Ortho PAC, applying to serve at the ASES Political Advocacy Committee, becoming a Frankle Advocacy Fellow, conducting research on advocacy, and of course, interacting with your local representatives. As surgeons, we have dedicated ourselves to excellence in patient care and lifelong learning. Think about advocacy as just an extension of this calling.